Hi, I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California. Today I'm going to be demonstrating the cannula technique for actually doing under eye or tear trough filling. So cannulas, as you can see here, they're a sterile, blunt needle basically. So if I were to poke this on the skin, it won't actually pierce it and it's not sharp. So the advantage of this is that you can it's flexible, so you may be able to be a little bit more careful and decrease the chance of bruising and swelling. So I converted over to mostly cannula use. I occasionally use a sharp needle when I'm doing under eye filling. About 2 to 3 years ago, when these Dermasculpt cannulas became available, I use a longer one, so I use a 2-inch one. And as you can see, I've made a little entry point with a numbing dot on the patient's cheek. And with that, I'm going to be able to fill in this tear trough region. So I'm going to get started. You're going to feel me pinching on the cheek. So with the little entry point, and this is often the hardest part of actually doing the filler process, is getting in there and getting down to the right plane. Perfect. And so I'm just going to advance the needle. I'm actually all the way just right on top of bone, just at what we call the medial canthus of that area of her tear trough, so just that very top apex of that. And I just slowly withdraw, and we're going to fill up that area with a little bit of Restylane. I have a strong preference of Restylane in this area. It's a hyaluronic acid filler, but it's a gel particle one, and it doesn't collect as much liquid or water after you've filled it. And so for that reason, I really do prefer it for under eye filling. If you use some of the other products, they can collect a little bit more water, and patients can sometimes have problems with swelling in the area after you've completed the under eye area. And I think a big key with people that are doing a lot of under eye filling is you want to make sure that the doctor doesn't overcorrect the area. In this particular patient, we're also going to do some global revolumizing of the face, so doing a little bit of volumizing everywhere with a volumizing agent called Sculptra. And so with that, we're actually going to be able to give a little support to the cheek underneath the tear trough, which I think will be super helpful for this patient, for just sort of minimizing the appearance of the tear trough and supporting it after we're actually done with the filler. Actually coming over here and supporting that middle cheek. There's a deep cheek fat pad that if we can support it a little bit, supports kind of the tear trough and makes it minimized in that respect as well. And so the big advantage, I think, for this is, since I've converted over, I have not had a significant bruise with doing the cannula technique since I converted over a couple years ago. You can see I used about 1/3 of the Restylane just in this area, just to give a nice sort of softening of it. One of the things that happens with tear troughs is you get a little bit of what we call hemosiderin pigmentation from the skin being really thin and little blood vessels traveling through it. And if you actually give a little bit of volume back over time, sometimes even that pigmentation softens, but she no longer has any shadow. She's not overcorrected. That's perfect, and that's just where we want her to be. I'm going to go and finish over on the other side, but just wanted to give a short demonstration of this. Again, this was tear trough deformity filling using a cannula, blunt-shaped needle, here at Art of Skin MD. I'm Dr. Melanie Palm. You can look us up at artofskinmd.com.